Good morning, everybody. It's great to hear the wonderful fellowship as we enter the Christmas season. Welcome to this very early edition to TACIR on Thursday, December the 19th. And I have been told that we have detected a quorum, so I'm thankful for everybody joining us this morning and look forward to a productive meeting. We've got quite a bit to cover. The first thing, tab 1, is to approve the minutes of the September 2024 meeting that is emailed to you previously. It is in your packet if you're using a notebook. It's on your iPad under tab 1. And without objection, we will receive approval of the minutes of September by acclamation. Thank you. Commission and staff update. Dr. Lippard, you're recognized.
Thank you, Mr. Chairman. First, I want to share with the members and our audience that since our last meeting, 2 former TACIR members have passed. Mr. Roselle Kreiner and Representative Tommy Head both passed in October of this year. Mr. Kreiner served as a private citizen member on the commission from 2010 to 2014. In addition to that, he served as an alderman in the city of Ripley, served 22 years as the mayor of Ripley, and 12 years as the Lauderdale County executive. Representative Head served on the commission in 2003. He served 9 terms representing the people of Clarksville in the Tennessee House of Representatives, to include service as the chair of the House Finance, Ways, and Means Committee. So if I could ask the members to join me in honoring County Executive Kreiner and Chairman Head's service to the state, their communities, and the people of Tennessee. Next, moving on to the staff update. I'm happy to share that in recognition of their excellent performance and great potential, staff members Jennifer Arzate, Carly Van Sickle, and Madison Thorne were all recently promoted to Senior Research Associates. So are they all here? If they could just stand briefly and congratulate these 3. Thank you. Also, Senior Research Associate Presley Powers has graduated from the state of Tennessee's Lead Tennessee training program earlier this month. Of course, as you know, Lead Tennessee is an intensive 12-month course designed to create a pool of leadership talent for the state. Is Presley here? No, she's not here, but congratulate Presley as well. And then finally, Research Manager Tyler Carpenter has gone over to the other side. No, he's still with us, but he has been elected. He is now an elected official. He's elected to serve on the Board of Commissioners of the town of Nolensville. And yeah, so Tyler here. Tyler also not here, but congratulations, Tyler.
He's in Nolensville.
Yeah, that's right. No. And then finally, I do want to share with the members that our Director of Administration, who several of you have met and known over the years, Michael Timmy, is suffering from a serious health condition and is on extended medical leave. We're eagerly anticipating him returning to the office. He's usually the guy who stays back at the office and lets us know if we're having problems with our mics or anything like that, in addition to, as we're finding out, all the other things that Michael does. But if you could just join me in keeping Michael in your thoughts and prayers, wishing him and his family well. We miss you, Michael, and we can't wait for you to get back. Mr. Chair, that concludes the staff and commission updates.
Thank you, Dr. Lippard. Grateful for that update, and we will be remembering our colleague, Michael, at this time. That rapidly takes us to tab number 3, which is Senate Bill 2877, House Bill 2961, and I think the sponsor is here. It is the capacity of crime labs in Tennessee, and there is a panel which will be introduced and discussed by Ms. Madison Thorne. Ms. Thorne, you're recognized.
Thank you. Good morning, Commission members. You can find the copy of this on tab 3. During the 113th General Assembly, House Bill 2961 by Representative Hardaway and Senate Bill 2877 by Senator Kyle sought to direct the Commission to study the feasibility of establishing a crime lab in Shelby County. The study was intended to evaluate the effect not only on Memphis and Shelby County, but also on the entire state. While the Senate bill passed, the House bill did not progress out of the Finance, Ways, and Means Subcommittee. Commission member and Representative Ryan Williams requested the Commission conduct a broader study to assess the feasibility and necessity of establishing additional crime labs throughout the state. The study will also evaluate the current capacity of existing labs to process crime evidence effectively and will consider potential locations for any new labs to optimize resources. A draft will be presented for review and comment at the spring 2025 commission meeting, with the final report scheduled for presentation at the summer 2025 commission meeting. Additionally, the City of Memphis and Shelby County are each conducting their own studies on the feasibility of a new crime lab in their respective areas. The City of Memphis' study was recently published, while the Shelby County study is still ongoing. TACIR will review and consider both of their findings. Forensic crime labs are essential for effectively and efficiently processing evidence, conducting investigations, solving crimes, and bringing cases to court in the pursuit of justice and public safety. However, when these labs lack sufficient capacity, it can result in delays in testing crucial evidence, such as sexual assault kits and ballistic evidence. In Tennessee, these backlogs have led to processing delays that can last for months or even years, ultimately hindering crime investigations and the resolution of cases. Today, you will hear from key stakeholders who are knowledgeable about the state's forensic crime labs and the effect that the evidence testing backlogs have on the judicial process. Today's panel includes Mike Little, the Assistant Director of the Forensic Service Division of the Tennessee Bureau of Investigation, Amanda Sweet, the Forensic Service Division Director of the Metropolitan Nashville Police Department Crime Laboratory, Stephen Crump, the Executive Director of the Tennessee District Attorneys General Conference, Jennifer Askew, Executive Director of the Tennessee Coalition to End Domestic and Sexual Violence, and Patrick Froeg, Executive Director of the Tennessee District of Public Defenders Conference. Just a reminder to hold all of your questions till the end of all of the panelists' presentations. Thank you.
Thank you, Ms. Thorne. And if members of the panel could join us here at the table. Ms. Thorne, unless there's another order, we'll just go in the order as was presented in the agenda, and that is Assistant Director Little.
Hi, I'm Mike Little. I'm the Assistant Director of TBI over the Forensic Services Division. I prepared a very short PowerPoint just to give you guys a little context of what our footprint is in Tennessee. This is provided to you in the handouts. We provide a monthly report to all of our customers listing what our turnaround times are in each major discipline, as well as what our inventory of case requests are. I think most notably on this, that's not a pointer. If you look at the bottom there, comparing 24 to 23, we have a 57% decrease in the number of requests that are pending. So our people have really done a great job in decreasing the amount of work out there and improving turnaround times. A little bit of history. TBI once had labs in Nashville, Knoxville, Jackson, Chattanooga, and Memphis. The old Jackson lab served all of West Tennessee, and the old Memphis lab served Shelby County and just a few of the surrounding areas. The old Jackson lab and the Chattanooga labs were closed in 2003 due to budget cuts. That left the Memphis lab as the only lab in West Tennessee, so by default it was serving all of West Tennessee, but it was really never designed or staffed to be the lab to service all of West Tennessee. Therefore, a new facility was built in Jackson, Tennessee to serve all of West Tennessee, and the Memphis lab was closed. But I must note that to minimize the inconvenience to Shelby County, since we did close that lab, we do pick up evidence at the Criminal Investigation Field Office in Memphis once a week. So every Monday, Memphis has the ability to deliver evidence in Memphis to that facility, and then we transport that to the Jackson lab for them. A little demographic information, looking at 2023 stats, 26% of West Tennessee cases in 2023 came from Shelby County. 74% of cases came from counties other than Shelby County. 65% of cases submitted from West Tennessee were submitted from places that are actually closer to where the Jackson lab is now, versus 35% of cases that would have been closer to where the old Memphis lab is. So we built the lab with an eye towards serving that entire geographic area, noting that the majority of counties are actually closer in driving distance to Jackson. This is just a little rundown and is provided to you in the handouts of what the requests by offense were from Shelby County in 23, just to show what their areas of emphasis may be. This is just a rundown of what services we provide at each lab. We do forensic biology, which is DNA testing, in all 3 of our labs in Nashville, Jackson, and Knoxville. CODIS, which is the DNA database, we do in Nashville and Jackson. Firearms analysis, we do in Nashville and Jackson. Toxicology and breath alcohol calibration, we do at all 3 labs. Forensic chemistry, which is seized drug analysis, we do at all 3 labs. And latent fingerprints or microanalysis, which is trace evidence, we do only at the Nashville lab. I should also note that the TBI Technology and Innovation Division controls our digital forensics. We don't do any digital forensics within the crime lab. I can answer basic questions about digital forensics, but we do have a couple of people here from that unit that can answer more specific digital questions if the need arises. We consider placement of laboratories not only for the evidence that we get, but also for testimony. In crime labs, we can't just do a test, issue a report, and then give what the reports are. It doesn't mean anything unless we can provide testimony. So we have an eye towards providing people in locations that are closer to where the evidence is actually going to come from. That's all I got.
Thank you, Director Little. And we, as Ms. Thorne, with all of the presentations, it takes us to Director Sweet.
Hi, I'm Amanda Sweets. I'm the Forensic Services Division Director for the Metro Nashville Police Department Crime Laboratory. Our crime laboratory is the only locally owned and operated crime lab in the state of Tennessee. So we service Davidson County specifically. We're considered a full-service laboratory. So we have forensic biology, which is serology and DNA analysis, firearm tool mark identification, drug identification, latent fingerprints, and toxicology. The crime lab achieved accreditation and started accepting cases in 2015. Although this was a very long, ongoing process, I believe they started talking about a laboratory in 2005, with the first hire being in 2008. In 2013, we moved into the facility, but didn't start taking cases until 2015. So why did the police department and city of Nashville want their own laboratory? For faster turnaround time and processing of evidence, to increase services such as property crime testing and DNA analysis, the ability to provide smoother prosecutions, enhance investigative capabilities, and better crime prevention, and more oversight and case priority within the police department. But I did want to bring up some of the challenges in opening a local laboratory. The initial cost over 10 years ago to build our 35,000 square foot facility was approximately $30 million. The additional cost of instrumentation and equipment and renovations was $4 million. Our annual operating budget is approximately $8.5 million, with salary and fringe accounting for $6 million and operating costs. So the cost to have service contracts, consumables, buy DNA kits, things like that, are $2.5 million. We do rely on grants and capital funds for the lab to operate efficiently. Another challenge is recruiting staff members for a local laboratory. You will need, to start a new laboratory, you would need very experienced scientists. You could not just hire entry-level positions. So recruiting people from other labs that have experience could be a challenge. We started the laboratory with a director, a quality manager, unit supervisors, experienced scientists, and a DNA technical leader. Other important roles to consider would be a business HR manager and IT manager, just because of the level of software and desktop support that you would need. Another challenge that we faced was underestimating the time required to build the lab, hire staff, order instrumentation and equipment, perform validations, and achieve initial accreditation. So like I said, we started the project in 2008, but did not start taking cases until 2015. I do feel like there's some advantages to local laboratories. It allows us the ability to work with one agency, the Metro Nashville Police Department, and one judicial system. So we're routinely dealing with the same DAs and defense attorneys on a regular basis. So that's one of the advantages. We have streamlined communication due to that, as far as evidence submission, acceptance criteria, and those established relationships with our investigators and the district attorney's office. The police department can have more oversight in what cases are deemed priorities in local laboratories, so they can have a chain of command approval, and we can look at that and determine which cases within their department they would like to prioritize. We do have very quick NIBIN, which is the cartridge case database, and APHIS, the fingerprint database, turnaround times. So we get cartridge cases and fingerprints entered within a few days. So that gives the investigators very quick lead times, and that's one of the advantages that we have working with one agency. We do have a good operating budget being under the police department, which allows us to have state-of-the-art instrumentation and allow for a lot of training opportunities because we are given that good budget. But that is one thing to consider in a local lab, is what does the budget look like for that police department or city. Some of the disadvantage that could occur with a local lab is you have smaller staffing. So to be an accredited laboratory, you have to have at least 2 people, a scientist and somebody that can do review of cases. So with a small staff, if you have turnover, you could get below that required 2-person staffing level. The salary and operating budgets to maintain a local lab could put a strain on a police department or city budget just because of the cost related to instrumentation, consumables, and things like that. We do rely on revolving capital fund budget to replace instruments and perform upgrades because instruments usually only last about 10 years, so you have to consider the replacement costs, and that can be very pricey. Being under the police department, you could have a perceived bias because you are being paid by a police agency, so that usually has to be addressed in court. The inability to maintain accreditation, appropriate staffing levels, or sufficient budget could result in casework being returned to a state agency. And we don't provide every service that the TBI is able to provide, such as microanalysis, just because we don't have that many requests. You would still have to depend on the state agency for some type of testing. That's all I have.
And I apologize to the panelists. I should have told you, with our new microphones, just be sure when you're done speaking to turn your microphone off and I've already got yours. I've got the kill switch up here, but when you're done speaking, if you turn your microphone off because the other person can't turn theirs on until you're done speaking. All right, thank you.
Since we have a panel on crime, let's not use kill switch.
Thank you, Director Sweet. Director Crump.
Good morning. My name is Stephen Crump. I'm the Executive Director of the Tennessee District Attorneys General Conference. Prior to that, I was an elected district attorney for 2 terms in the 10th Judicial District, and prior to that, I was an assistant district attorney in that same district. I think the best insight that I can give this panel are the ways that law enforcement and prosecutors interact with labs, and there are 3 ways in which prosecutors and law enforcement are called upon to operate inside the scientific or forensic realm with the scientists at a lab. The first, obviously, is the one that you've already heard about, the testing itself. Most local law enforcement agencies don't have any capabilities to test any sort of forensic or scientific evidence. They can't perform any analysis at all. And so they are heavily reliant upon the Tennessee Bureau of Investigation to process that evidence for them once it's delivered. But it goes beyond that. The labs also serve a very important function to us in that, particularly in serious crimes, their lab teams, they have actual teams that will respond in the field to crime scenes and assist local law enforcement in processing the scene, collecting and documenting evidence, and then also pushing that evidence back to the lab that will ultimately be processing it. That provides an enormous service, particularly to our smaller departments. They are able to then focus on the who's and the where's and the why's as opposed to the how's. They can go and start interviewing people while the crime lab teams actually do the processing of the scene in conjunction with some of the other folks. And then lastly, none of this actually means anything unless we have somebody who can come and testify in court for us. The experts in these labs provide an enormous function in that in today's world, we all live in a judicial system that is captured by the CSI effect. We have to explain to juries that, no, we can't get fingerprints off of feathers. No, those fancy computers that just come up in the air don't really exist. We cannot zoom in from a satellite that we've located on the moon and clean a digital photo from 193,000 miles. Those things, people have gotten used to that. And so perhaps the most important thing, and I think the human side of this, is that the people in the labs take these very scientific, very esoteric, very complicated and technical subjects, and they educate the average citizen as to how science actually works within the criminal realm, and takes out the sort of the Hollywood and puts in the Main Street. It takes what we understand as common sense human beings, and it adds to it in the scientific basis. They do that regularly in our courts. They do it with great expertise, and we're very fortunate to have the people at the lab, the Tennessee Bureau of Investigation lab, who serve our prosecutors and law enforcement, juries, judges, and court systems across Tennessee. And with that, I'll conclude.
Thank you, Mr. Director. Director Rescue.
Hi, my name is Jennifer. Okay, sorry about that. Jennifer, CEO, Tennessee Coalition to End Domestic and Sexual Violence, and I've been asked to speak about the impact of crime lab processing times on victims. So I first wanted to say that last year we worked with the General Assembly to expand the civil statute of limitations for adult sexual assault cases, and that was largely due to a victim's story where her rape kit was lost, but because processing times were taking so long that no one realized it was lost until after the civil statute of limitations had passed. So then she was left without evidence for any criminal charges and left without the option for recourse through a civil case. So the processing that happens, it has irreversible consequences. Now, I do want to acknowledge that there's been a lot of progress made by the TBI, and it keeps getting better. Now there are tracking systems that the victims themselves can use to track where their sexual assault forensic exam kit is. And we're also seeing some turnaround times in some jurisdictions of as quick as 8 to 12 weeks, which is a significant improvement. However, there are some jurisdictions where they're still seeing processing times taking 6 to 9 months on those forensic exam kits. And every day that a kit remains unprocessed is a day that an offender could potentially cause more harm. It causes delays in the process. It perpetuates cycles of harm. And during that time, we also have some victims who will receive letters, particularly around the 90-day mark, from law enforcement or perhaps prosecutors stating that their case is being closed due to lack of evidence. So those cases can be reopened and will be reopened once the results of the forensic exams are processed. But for victims, those notifications are confusing and they're devastating, and it makes them feel like the system has really given up on them. So having long wait times can cause victims to lose faith in the system. They can feel really traumatized and frustrated with the process, which often will lead to disengagement with the criminal justice process. So even if they were wanting to cooperate with the prosecution at first, many of them will drop out just because of the toll it's taken. Additionally, they will also are often working with, it's important for victims to work with nonprofits that provide sexual assault services, domestic violence services, and they will kind of serve as advocates for them throughout the criminal justice process. But if they are spending a lot of time waiting for the case to move forward due to processing times, the victims may have finished those services and kind of moved on. So when a victim witness coordinator reaches out to try to get in contact with the victim for the case, they're not going to have as easy a time connecting with them. They might have changed phone numbers, changed addresses, and then are also no longer working with the sexual assault program that might be able to help serve as a liaison and keep people posted on where the victims have gone. So then there's sort of a larger impact because every victim doesn't just represent their individual story, but it's a reflection of how well our system works as a whole. So when crime lab processing times are slow, it doesn't only harm the victims emotionally, but it erodes trust in law enforcement and the criminal justice system on a larger scale, which creates a ripple effect where the victims become less likely to report assaults, less likely to cooperate with prosecution, and less likely to achieve justice.
Thank you. And that takes us to Director Patrick Froeg.
Hi, I'm Patrick Froeg. I'm the director of the Tennessee District Public Defenders Conference. In anticipation of today, in the last month, I tried to reach out to most of the public defenders across the state to really talk about this issue. And what I found was a little bit different than what you've heard so far. Most of the public defenders, I think like everybody, is frustrated with delay. And you might think, well, what do defense lawyers care about delay? Doesn't that work often to help your clients? But honestly, 90, 95% of cases are settled and settled relatively quickly. A lot of cases, particularly drug cases, are waiting on forensic chemistry from the lab. And they're typically waiting in the time period between general sessions and circuit court. The DA can't do anything. They're waiting to indict the case until they find out the quantity and the type of drug, and they're waiting on a forensic analysis. And I didn't get to see the PowerPoint slide. It went by pretty quickly, but I think the forensic chemistry was the tab that was taking the longest, and that squares with what I'm hearing from the public defenders, that often what they're doing, they'll get a new case, there's some amount of drugs, there's maybe multiple defendants, and everybody's sort of waiting to see what their co-defendant had to see how the case progresses. And those people are sitting, often willing to take a plea, ready to get on with the sentence and go to the Department of Corrections, but they're sitting in a local jail waiting for the forensic analysis. And I think we don't have the capacity, is my understanding. I'm not there. But I also think these forensic chemistry analyses are probably lower in priority to some of these issues that you just heard about from Director Eskew. So I think it becomes a bottleneck, and it's one of many, but it's a significant one. And so it ends up making our caseloads higher, cases drag on. It's a significant delay. And I think it really matters more, particularly when you think about the rural counties where the grand jury doesn't meet every month. Maybe it's every 3 months. And when that's happening, you can add that depending on when the analysis happens. You might be waiting on the grand jury, you're waiting on the forensic analysis, and so you're just sitting, waiting. And everybody's frustrated. This is a point where we aren't adversarial with the DAs. We're all waiting for the lab test to see how to proceed with the case. That's really all I can add. Thanks.
Thank you, Director. Thank you. This now opens up for members of the TACIR Commission to ask questions. Does anyone have an opening? Senator.
Thank you, Mr. Chair. So I know that, first of all, I guess we don't really know from your comments whether or not the recommendation is that we actually need more crime labs, which seemed to be the directive of the study. So I guess I'd like to know kind of what people think about that. I know TBI has improved significantly with especially rape test processing, but not so much in Metro Nashville. So I'd like to know what's going on with that in terms of our numbers in Metro Nashville. And then I guess I'd like to get some perspective on whether or not you all think that per the directive of the study, we need to increase the number of our crime labs. So I guess I direct that towards the director of the Nashville Bureau. And then if anybody has an idea as to whether or not we need more crime labs, that'd be great. Thanks.
Okay. To start out, my position is I'm indifferent on what is decided about the crime laboratories. It would not affect our testing. I just wanted to provide some of the challenges and some of the advantages to having a local laboratory to be considered. So as far as our turnaround times are fairly good in most of the disciplines now except for DNA analysis. One of the challenges I had mentioned before was staffing levels in some key positions. So we actually went for some amount of time without a position that's mandated by the FBI, which is the DNA technical leader. We had a supervisor that left after 10 years with us, and she served in that role. However, you have to have this to be able to enter profiles into the CODIS database. During the time of that vacancy, we could not start new DNA testing. We could not enter cases into the CODIS database. and we could not complete people's training program. And that did put us behind in sexual assault kit testing. We hired a DNA technical leader in May 2023, and his main goal has been to get people through the training program, and that allowed us to start doing DNA testing again. So that is one of the challenges with a local laboratory is staffing levels and filling those key positions and keeping those people in those positions. So at this time, we do have about a 750 case backlog of sexual assault kits. We just got CBIR grant funding to outsource some of those kits, and we are prioritizing training to have 9 reporting DNA analysts by the end of this year so that we can produce more cases every month.
Anyone else on the panel like to follow up with that question?
I guess I can just say from TBI's perspective, it is challenging to run a small crime lab, that if you lose key personnel, that can shut you down and you have to fall back on other things. We have run into that in our Memphis lab back when we had one many, many years ago. But there is the advantage of having better communication between law enforcement and that crime laboratory. I think to address what the Public Defender's Office mentioned with regard to drug cases, I think he stated that 90 to 95% of drug cases plea before they get results and need those for court. We don't get that information. We're testing those cases anyway because nobody's telling us that those cases have pled. If we had that kind of communication, we could greatly improve service to our customers. And then just to address drug chemistry in general, a year ago we had over 11,000 pending requests. Now we have 3,700. Our statewide turnaround time in drug chemistry was 24.6 weeks a year ago. It's 11.5 weeks now. So we have greatly improved, but we are testing, probably in drug chemistry more than any other, a number of cases that really just are not needed for prosecution.
I have Mayor Frank on the list, and then we'll have Mayor Brown.
Thank you, Mr. Chairman. I have 2 questions, if you'll allow me to ask one and then do a follow-up. I guess this would be maybe for General Crump. If we reduce backlog, I guess I'm asking, what is the capacity of attorney generals, court scheduling, public defenders, to actually address the case? And so there has to be a balance, obviously. So if we expedite testing, will the case then move to sitting on a shelf in the courthouse and in the DA's office? What's maybe that balance there? You know, when dollars are limited, if we speed things up, then are we going to need more DAs, more public defender dollars, all of that in order to expedite?
Thank you very much for the question. I don't know that more DAs would be needed based upon that. I think you would see 2 things. First, really, the number of cases that can be tried is more a function of how many judges there are. In the 10th Judicial District where I practiced, judges typically did non-jury days on Mondays and Fridays, with trial days Tuesday, Wednesdays, and Thursdays, and occasionally on Fridays if cases bled over to that day. And so you have 2 judges in the 10th Judicial District. They work an average of 40 weeks a year in court, and so that gives you roughly 200 trial days a year potentially. No matter how you speed up testing, that's not going to change. But I would say this, testing does produce quicker resolutions of cases. Many times, defense counsel will say, I can't in good conscience plead this case until I'm certain of what this weight is or what this substance is. And so I think you would see quicker resolutions. And also from our perspective, we are hesitant to indict somebody without that. Now, the science is moving in a different direction with field testing that would allow for both preliminary hearing and grand jury testimony based upon a preliminary field test, which would greatly cut down the number of actual laboratory tests. Because if you get that first test in, frequently the cases do resolve. So I don't think that it would. I don't think that it would do that that it would change that necessarily. And to go to Senator Campbell's question, we don't care if there are more locations. There just have to be more scientists. The DA in Memphis that I serve and is one of my bosses is adamant there needs to be a crime lab in Memphis. And certainly if that speeds things, then absolutely we should do everything we can. But the key is the same scientist doesn't do all the tests. The scientists are broken down into various disciplines based upon their expertise. And so if you build a crime lab in Memphis, in order for it not to be just a gimmick, it has to be full service. It has to do everything, and it has to be fully and adequately staffed in order to do all those things. As executive director, I am constantly paying for experts where stuff has been outsourced. I've paid for the Davidson County Crime Lab, for Metro National's Crime Lab. I've paid a lot for DUI cases where their toxicology during COVID, got sent out to other labs. TBI doesn't do everything, and so we're frequently having to get labs that do outside farther, particularly in DNA, further testing. And so if we're going to do it, I think if you focus on the core backlogs, the core numbers, and the last number that I got, the one that's the highest is firearms analysis. It's 71.3 weeks to get a firearms analysis back. And listen, I'm not blaming Mike Little and TBI. There are literally thousands of firearms that are sent to them every year, and they work nonstop to get these things to us. But whether you build a building or you don't build a building, the answer to all this is more scientists. And maybe we do need more buildings because we got to have a place to put more scientists. They can answer that question. I don't know what their physical plants are, and I don't want to speak to that. But the only way this is going to change is if you change the number of people who are actually testing the evidence.
Thank you, General. And that actually dovetails with what I was going to ask Director Little. To his point about more physical locations, your chart is really a magic chart in that it shows the specific areas where there is longer wait times. So would there be more benefit in somehow addressing the staffing issues or for those particular areas of testing? And just as an example, in chatting with our folks in the medical examiner's office in Knoxville, one of their challenges is they need more pathologists, and they're not out there. So I just would open that up to you.
Sure. So we were fortunate that a couple of years ago, the General Assembly granted us 50 new positions, which we spread throughout the forensic division where we felt the need was the greatest. It takes differing amounts of time to train people in different disciplines. It takes about a year to train somebody to do drug chemistry, and we have all of those people hired and all of those people out of training, and we've seen some real benefits from that. In firearms, it takes 2 years to train people. So we're lagging behind in firearms because we have a number of people sitting in training. A couple of years ago, statewide, we were about 37.5 effectiveness in our staff being trained in firearms. Right now, across the state, we're at 62.5%. As we get those people trained, it's going to improve. I feel that we have the adequate staff in place. It's just going to take a little time to get there.
Thank you, Mayor Brown.
Thank you, Chairman. Following Mayor Frank's line of thinking, mine was quite similar. And because I'm thinking that what we're going to wind up seeing is that the expertise, the workforce expertise is what we need most. And wonder if that opportunity is actually going to lie in education. But my question is if you did have thoughts about the educational offerings within our state that would prepare people for those jobs, but then also on a national basis, does our turnaround time exceed what other states are doing, or is it are we showing as woefully inadequate? Because I bet the challenge is the same across the board with expertise and not so much about physical locations. Not to put in my thoughts on it, but yeah, I bet that's the direction that we're.
Just looking at the study from Memphis as well as kind of anecdotal conversations with other people across the country, I think that we're in similar situations. You talk about education. It takes a long time to train people to do forensic science, and we have had conversations on a national level many times about this, is that people don't come out of college fully formed. That perhaps there is some meat on the bone to discuss some sort of a unified training program to where we can hire people that are trained, because right now when we get somebody out of school or with no experience in the field, it may take us a couple of years to get that person trained. And there really just is a shortage of trained people out there. It's not like we haven't thought to hire trained people. They just simply don't exist.
Thank you, Mayor Brown. Any other members of the commission with questions for the panel? Mr. Peach.
It's probably more of a statement, but I guess from Director Little or General Crump, I hate to go too far outside the scope, but I don't think a lot of people may know, as far as general citizens, that autopsies are not performed at these crime labs. And so it seems to me that those should be a state function. And so what are your thoughts on joining medical forensics with the crime labs throughout the state? Because with the private, they could just keep raising prices and prices, and the counties can't afford it.
Our offices are typically served by the regional forensic centers, and I would never say to Director Little that I'm going to add to his basket of goodies. It seems to me that would be a bad thing for me to suggest. I think where they are right now, yes, I can tell you, and I am certain as the counties have had to pick up higher and higher costs for autopsies, it was a challenge when I was district attorney. My largest county, Bradley, the county mayor had a very significant issue with the number of overdose autopsies that we were having to perform. We were literally performing dozens of those, and there's only so much money that a county can budget in a particular year for that sort of thing. And so I certainly recognize the challenge that you're talking about. I don't think we should put them together. I think them being separated, it works the way it is, but it is, I cannot deny that there's a significant challenge when it comes to the cost to the local authorities and to TDOC, who has to pay for some of those. If the DA orders it, then TDOC is required to pay. And so it is definitely a problem, but I don't think it'd be solved by putting them together.
And I would also agree with General Crump's statement on that. And I can also speak that from my experience, approximately 25 years ago, we were receiving toxicology samples routinely from medical examiners. Case after case after case were natural death cases that really had no business at a crime lab. So it really just kind of serves two different populations. So it's probably better now that the medical examiners work separately from us, because many of the things that they deal with, they just simply don't involve a crime.
All right. Any other comments or questions from the commission? Ms. Eskew, I had one question. During your comments, Director Eskew, I should say, during your comments, you mentioned two different jurisdictions. One was an 8 to 12 week turnaround. One was, I believe you said 8 to 9 month turnaround. Do you have the specifics of where it's a very large difference in those two turnaround times?
It is a big difference. So just anecdotally, so 8 to 12 weeks, I believe, is what the TBI is working toward and what we're seeing a lot of. And that, so speaking to someone, I believe I was in Johnson City, talking to someone saying they're seeing 8 to 12 weeks. Chattanooga, on the other hand, seems to have a more inconsistent timeline and things are taking longer. So it could be the size of the city. I don't know exactly where that delay is happening, but yes, the turnaround times are not yet. There's an overall trajectory of improvement. They're not yet completely consistent.
Thank you. Director Crump?
Mr. Chairman, I would say that in the most recent, every month we get turnaround times from TBI. We get a memo that talks about average turnaround times. And I looked up, I'm just looking at sex offense for forensic biology, where there's only a kit. The turnaround time in Nashville is 5.6 weeks. The turnaround time in the Knoxville lab is 11.3 weeks, and in the Jackson lab, it's 11.2. I can tell you that that's very well within the tolerances that my colleagues who do the same job that I do now across the country, that's not an unusual amount of time for those kinds of cases. I think it represents the true priority that have been placed, that these tests have been placed with in TBI.
All right. I see no one else asking to be recognized on the commission. To all the members of the panel, thank you for this very valuable information, and we are grateful for your service. Thank you. Ladies and gentlemen, we will begin the transition for tab number 4. If we could ask for tab number 4 and Dr. Michael Strickland, Public Chapter 1013. Dr. Strickland, you're recognized.
Thank you, Mr. Chair, and good morning, Commissioners. This is, as just noted, the draft report on vendor compensation for sales tax collection, located behind tab 4 of your docket books, and being presented for your review and comment. This study, as you may recall, was taken up in May in response to Public Chapter 1013, Acts of 2024, and was meant to cover 3 questions. 1, the cost to businesses of collecting and remitting state and local taxes. 2, the cost to the state for reasonable remuneration for sales tax collection, including vendor compensation to businesses as compared to other states. And 3, the cost to businesses of payment card interchange fees on the tax portion of transactions. Looking nationally, 27 states offer businesses some amount of vendor compensation for sales tax collection, while 16 others do not. Tennessee itself is something of an outlier, only allowing vendor compensation under very limited conditions for out-of-state businesses, but not in-state ones. Although, just to be clear, the Department of Revenue is not aware of any out-of-state businesses that are actually claiming vendor compensation from Tennessee. Whether to offer vendor compensation depends on how the state wishes to view the role of businesses in sales tax collection. There are basically 2 interpretations. In one, it is consumers who pay the sales tax and businesses are just the tax collectors, which might suggest that they deserve some compensation for performing that work for the state. In the other interpretation, though, sales tax collection is simply a cost of doing business and no different from complying with other legal requirements, and therefore compensation would not be warranted. The available evidence does not decisively recommend one of these interpretations over the other. If the state does wish to reinstate vendor compensation, though, there are ways to ensure it is done equitably. Because sales tax collection costs tend to be a larger percentage of sales tax collections for small businesses than for larger ones, no one rate of compensation is appropriate in all cases. Vendor compensation that's set at a single flat rate and left without a cap runs the risk of compensating large businesses more than it costs them to collect the sales tax. And it should be noted the cost of collection for all businesses has fallen over time, largely thanks to improvements in technology. An additional consideration is that vendor compensation directly reduces sales tax revenue, but a cap on compensation could help the state control the amount of revenue forgone. Both tiered rates and a cap were in use when the state brought back vendor compensation on sales tax for 1 year in fiscal year 2022-23. For these reasons, if the state were to reinstitute vendor compensation for sales tax collection, the draft report recommends it continue to use a tiered set of rates and a cap structure to ensure compensation for smaller businesses for whom the relative costs of collection are greatest, without creating either a windfall for larger businesses or a revenue shortfall for the state. Apart from vendor compensation, another concern of businesses is payment card transaction fees, also called swipe fees, and the portion of them that derives from sales taxes. When consumers pay for something with a credit or debit card, the retailer must pay a processing fee that is set at a certain percentage of the total card transaction amount, typically somewhere between 1% and 4%. Businesses say that they should not be responsible for paying card transaction fees on the sales tax portion of transactions, given that the sales tax is money that they are only collecting for the state and do not retain for themselves. There have been proposals for the state to exclude sales tax from how these fees are calculated, but the legality of doing so is uncertain. Illinois enacted legislation requiring businesses in that state to exclude sales tax from card transaction fees starting July 1st, 2025. But financial industry stakeholders say that this will be difficult to implement, may require significant changes to card processing equipment, will not save businesses as much money as they hope, and could lead banks to raise the cost of other services for their customers. A group of these stakeholders has sued the state of Illinois over the new legislation, arguing that the state is preempted by the Federal National Bank Act, among other federal laws. Given that the effects of excluding sales tax from card transaction fees are unclear, and that the lawsuit on the legality of such exclusions is currently underway in Illinois, the draft report recommends that Tennessee refrain from taking any action on card transaction fees until more information is available from the test case in Illinois. And so with that, I'm happy to take any questions that you may have.
Thank you, Dr. Strickland. Very grateful for your draft report. It does not require a vote today, but it is open for discussion from the commission. Any questions for Dr. Strickland at this time? I see the House sponsor, Chairman Hawk, is here. Good to see you, sir. All right, seeing no questions, a vote is not required. Dr. Strickland, thank you for your time. We look forward to hearing from you again in the future on the test case in Illinois.
Thank you.
All right, that takes us to tab number 5, which is public chapters 934 and 938. It is Bob Moreo. Mr. Moreo, thank you.
There we go. Thank you. Today I'm presenting our draft of the Commission's report on issues affecting the child care workforce and availability and affordability of child care in Tennessee. This report is the product of studies directed by 2 public chapters passed by the General Assembly earlier this year. Following your feedback on the draft report, the final report will be presented for approval at the Commission's January meeting to meet the public chapter's January 31st, 2025 deadlines. Public Chapter 934, Acts of 2024, with sponsors including Senators Campbell and Yarborough from the Commission, directed the Commission to study the characteristics and conditions of child care workers in Tennessee and to explore the feasibility of expanding incentives and financial support programs for early childhood educators. Public Chapter 938, Acts of 2024, sponsors included several Commission members, Representative Williams, Senators Watson, Yeager, and Yarborough, directed the Commission to identify laws, regulations, and rules that impose costs, financial burdens, or operating delays on child care business owners or prospective owners, and to evaluate whether some of these barriers may not be necessary to protect the health, safety, and welfare of children or the community. These public chapters are included as Appendix A with the draft report. Pursuant to the study's requests, the Commission staff conducted 6 focus groups and over 45 interviews. Staff attended Southwest Tennessee Development District's Child Care and Industry Workshop. We conducted an online survey of child care directors and owners to find out about their experiences, the children they serve, and their employees. 364 child care directors and owners responded to our survey, the results of which are included as Appendix B with the draft report. The Commission also welcomed a group of guest panelists for discussion on child care at the September 2024 meeting. This stakeholder outreach and the Commission's additional research have underscored difficulties identifying broad-based solutions for problems faced by the child care sector in Tennessee. Through regulation and policies, governments play an important role ensuring that child care providers operate safe facilities where children can develop and grow. More than 60% of the survey respondents said they had no difficulty complying with state and local regulations. However, many did report difficulties, and throughout the focus groups and stakeholder interviews, there were some rules and regulations mentioned by participants that warranted further examination. Additionally, hiring and retaining workers is a difficult challenge for child care businesses. 55% of responses to our online survey cite one or both issues as a major problem. Compensation in the child care industry is notoriously low. 1 in 10 child care workers falls below the poverty line. The average wage is around $13 an hour. Yet, despite these low wages, payroll is the greatest operating expense for child care businesses. Owners are often frustrated that they can't afford to increase wages or offer benefits for their workers because many Tennessee families simply can't afford to pay higher child care prices. In many counties, fees for a single toddler in child care are more than 15% of a median family's income, double the benchmark set by the federal government for affordability. So although an all-inclusive solution doesn't seem to be within reach, the Commission has identified several opportunities for improvement. The draft report includes recommendations for areas where cooperation and coordination between state and local government and child care operators could be beneficial. It also recommends modifications that could be made to some state and local regulations without endangering health, safety, and welfare of children of the community. And it recommends possible opportunities to improve compensation and encourage the retention of child care workers and ways to increase the state's support for its child care businesses. So first, I'll discuss some opportunities to reduce barriers at the state level. There are opportunities for the state agencies that oversee child care providers in Tennessee to improve services, streamline processes, and better align policies in ways that lower barriers to opening or expanding facilities and reduce operational burdens on child care providers. Child care facilities and programs in Tennessee are governed primarily by 2 state agencies. The Tennessee Department of Human Services Child Care Services Division is responsible for ensuring the availability and quality of non-school-based, for-profit or nonprofit child care in homes and child care centers. The Tennessee Department of Education's Office of Early Learning is responsible primarily for governing early childhood education programs and school-age before and after care programs located in public and private schools. Another state agency with an important role in regulating child care is the State Fire Marshal's Office, which is responsible for reviewing child care building plans, pre-licensing fire safety inspections, and annual fire inspections for purposes of DHS licensing. The Fire Marshal's Office is also responsible for reviewing school building plans, pre-certification, fire safety inspections for new schools, and annual fire safety inspections for the Department of Education. In our focus group discussions and interviews, child care directors and other stakeholders said more opportunities are needed for child care providers to share their feedback with DHS staff. They said DHS has had held regional meetings in the past to educate providers about rules and regulations, and the DHS would benefit from feedback regarding enforcement of rules and regulations by its staff and hearing where there's confusion among providers. Stakeholders told Commission staff that building code and fire safety requirements are frequently the source of confusion and delay during the pre-licensing process. This feedback from providers was less about problems with the regulations themselves and more about frustrations over inconsistencies, interpretations, and miscommunication. For these reasons, on page 3, the draft report has a recommendation that DHS reestablish regular regional meetings with child care providers in person and with the ability for virtual participation, and to include staff from the State Fire Marshal's Office. DHS has told us they would agree to doing this. DHS has told us they agree to doing this, and the State Fire Marshal's Office has said they would agree to participate. We also hope that local fire and building officials would be included in these meetings as well. Another opportunity for the state to remove a policy barrier has to do with regulations for school-age extended care programs. Extended care programs for school-age children, they're administered directly by schools, as well as those run by some nonprofits funded through 2 DOE extended learning grant programs. These are approved and monitored by the Department of Education. Current law requires extended care programs operated in schools by other non-school organizations to be licensed by DHS. And while most DHS and DOE regulations for school-age care are in alignment, DHS licensing requires an additional fire inspection for portions of a school that are going to be used for new before and after school programs. As a result, these before and after school programs located in schools but operated by an outside agency such as the YMCA must pass an additional fire code inspection before opening, where those operated by the school in the same building would not. This can lead to some delays in getting approval for programs run by these outside agencies and therefore prevent programs from opening up to serve families. Given that these school buildings have already been deemed safe enough to house the same age range of children during their regular school day, and they would be deemed safe enough to house the same children in a before or after school program if the program were run by the school, page 4 of the draft report includes a recommendation that DHS align its fire code inspection requirements for before and after school programs operated by these non-school entities in schools with the DOE's requirements for the same programs run by the schools themselves. And DHS has again told us that they would agree with this recommendation. The draft report also says that building and fire code inspections at the state and local level should be further coordinated. Until recently, local fire marshals in 6 counties and 38 cities had the authority to conduct pre-license and annual inspections required by DHS for child care licensing purposes. In all other jurisdictions, the state fire marshal had been responsible. Delays with local inspections in some cases were causing licensing problems for child care operators. And so as of August this year, the State Fire Marshal's Office has assumed responsibility statewide for reviewing all building plans and inspecting all child care facilities for the purposes of DHS licensing. However, this does not mean that child care facilities aren't also subject to separate review and inspection by their local building and fire officials. In communities with locally adopted building and fire codes, local fire marshals continue to perform local non-licensing plan reviews and inspections to ensure compliance with these local codes and to ensure that their local fire departments are familiarized with buildings when responding in the case of emergencies. This has created some confusion. The change has created some confusion for child care businesses because now they feel like they're experiencing more inspections. They've also reported incidents where the State Fire Marshal's Office has approved a facility for DHS licensing purposes, but local inspectors have cited changes that must be made for compliance with local building or fire code requirements that owners weren't made aware of. So on page 5, the draft report includes a recommendation that the State Fire Marshal's Office invite local fire marshal offices to conduct their initial inspections and any follow-up inspections at the same time and same day as the State Fire Marshal's Office inspections in order to minimize confusion for child care agencies when they're opening a new facility. This is something the State Fire Marshal's Office has told us that it would agree with. And the draft report also includes a recommendation that these local jurisdictions ensure that their pre-occupancy inspections are in turn coordinated with state pre-licensing inspections in order to avoid lengthy gaps and delays between approval for pre-licensing by the State Fire Marshal's Office and final approval for occupancy by a local fire marshal. The draft report goes on to describe additional opportunities for local governments to reduce barriers for child care businesses in their communities. Local governments have the authority to organize and regulate how land is used in their communities through zoning. Just as they do for all land uses, zoning ordinances determine where child care businesses are permitted to locate within a community. But local zoning policies are sometimes more stringent than the state's licensing requirements, and in some jurisdictions, zoning requirements are stricter for child care facilities than they are for similar uses like schools and churches. One area, for example, where we found local zoning requirements that exceed DHS licensing standards for child care was with regards to outdoor play space. DHS requires licensed child care facilities to have 50 square feet minimum outdoor play area per child. This is a little on the low end, but generally in line with other states. 75 square feet per child is the most common state requirement, and no state requires more than 100. But from the sample of cities we looked into for this study, a few had much higher requirements. The city of Lawrenceburg, for example, requires there be 200 square feet of outdoor play area per child. Cities of Lexington and Humboldt require a 1,400 square foot minimum play area regardless of capacity, which for a child care home licensed for no more than 7 children is also 200 square feet per child. And just for reference, I did the math, and a high school basketball court is 50 feet wide, and it's 25 feet from the baseline to the top of the three-point line, and that's only 1,250 square feet. So that's a visual of what the minimum of what they're talking about. The city of Farragut has a 3,000 square foot minimum regardless of license capacity and requires 100 square feet per additional child. Requirements like these are just examples, eliminate certain properties that could otherwise be used for child care facilities, and they can drive up costs because of the need to acquire larger lots. Another way zoning can restrict child care is by treating it differently than similar uses like schools or churches. Chattanooga, for example, churches and K-12 schools, including those operated by religious organizations, are permitted by right in all residential zones. But daycare centers, which the city defines as any child care facility with the capacity for 8 or more children, can only be approved by special exception going through the city's Board of Appeals. Because of the differences in community needs across the state, effective solutions are likely to be locally tailored rather than state-driven. But when faced with a shortage of child care providers in their communities, local planning officials should consider how their zoning ordinances may be restricting opportunities for child care businesses. Therefore, on page 6, the draft report includes a recommendation that local governments align their zoning for child care businesses with zoning for schools and churches, and for local governments to review their zoning ordinances for restrictions like the examples given in this report. There are also instances where local building and fire codes establish stricter requirements than the state's requirements for child care facilities. The State Fire Marshal's Office is responsible for establishing and enforcing minimum statewide building construction safety standards in Tennessee, but local municipalities have the authority to adopt more stringent standards. The City of Memphis, for example, has adopted stricter requirements than the State Fire Marshal's Office for ventilation and fire suppression systems in commercial kitchens. The most commonly adopted additional local requirement pertaining to child care facilities is for sprinklers to be installed in buildings where the state's adopted code would not otherwise normally require them. Under the statewide building code, child care facilities under 12,000 square feet that serve fewer than 100 children would not require a sprinkler system as long as classrooms are at the ground level and each has its own exterior exit door. However, Gallatin and Nolensville, for 2 examples, have amended their codes to remove that exception. Ashland City has required sprinklers in all new buildings since 2004. Farragut and Shelby County outside of Memphis require sprinklers in buildings over 5,000 or 7,000 square feet, respectively. Interestingly, Knox County had adopted an ordinance in 2018 requiring sprinklers in any daycare facility with 7 or more children. However, they found after a few years that the requirement had been unnecessarily restrictive, and it was in fact repealed in May of 2023. Sometimes the local building permit process is more costly and time-consuming than a process required by the State Fire Marshal and DHS for pre-licensing approval. The state allows applicants moving into an existing child care space with fewer than 25 children to have review for code compliance determined through an inspection on site by the State Fire Marshal, rather than submitting plans. For existing buildings under 5,000 square feet that will serve less than 100 children, the state allows for a limited review of as-built plans in lieu of full plans prepared and signed by a licensed architect or engineer. DHS gave us one example recently from Kingsport where, although the state has said it doesn't need a full set of plans, the city requires plans prepared by an architect for any child care serving more than 5 children. So on page 7, the draft report includes a recommendation for local governments to align building and fire codes with state standards wherever appropriate. As with zoning, state preemption of local codes would not account for the important needs of differences among communities. But again, when looking for opportunities to facilitate access to child care in their communities, local officials should take into consideration the effect of local codes, especially when they're more restrictive than state standards. The draft report also includes a recommendation for the state to provide additional support for child care workers. Child care business owners in Tennessee say they're concerned about attracting and retaining workers because of low wages, and raising wages would require raising prices, which families in the communities cannot afford. According to the U.S. Bureau of Labor Statistics, the average hourly wage for child care workers in Tennessee was $13.21 in 2023. And multiple child care directors told commission staff that they are regularly losing workers to retail establishments like Target and Walmart or casual restaurants like McDonald's and Chick-fil-A. The state has one program in place to help supplement child care wages. Child Care Wages Tennessee is the state's existing education-based salary supplement program designed to reduce worker turnover by rewarding child care workers for continued education. Information about this program begins on page 55 of the draft report. To qualify, educators must work in a DHS-licensed child care facility for at least 6 months, working at least 10 hours a week with children younger than 6 years old, earning $20 an hour or less, and have at least 6 credit hours of early childhood college coursework or a bachelor's degree in any field. As shown on pages 56 and 57, annual wages supplements begin at $600 and can increase to as much as $7,800. As of December 5th, 1,649 child care workers were active in the wages program, and there have been over 4,000 educators participating throughout its existence. But many stakeholders, including child care directors, told us that some of their most experienced workers aren't interested in pursuing further higher education. They would like to see a program that targets bonuses to child care workers without higher education credentials, but who maintain longevity. The draft report includes examples of incentive programs in Virginia and Georgia that aren't tied to higher education. On page 8, we have a recommendation that the state do develop a program like child care wages to reward workers for years of service and incentivize their commitment to careers in child care. Moving next to ways the state could help child care business owners, the draft report considers how underutilized and vacant public school properties could be used for child care. Real estate's especially expensive in Tennessee's most rapidly growing communities, where child care demand is high and appropriate facilities are difficult to find. To help facilitate solutions for public charter schools in these areas, the state law requires local education agencies to inventory underutilized and vacant properties annually and make them available for use by offering properties for sale or lease to charter schools within the LEA. Because child care operators might also benefit from priority access to these types of surplus properties, page 9 of the draft report includes a recommendation that the General Assembly amend the law to give child care providers the same opportunities as public charter schools to purchase or lease LEA underutilized or vacant properties. The American Rescue Plan Act of 2021 included $39 billion in new federal child care funding, including $24 billion for child care stabilization grants to providers and $15 billion in supplemental child care and development funds. Tennessee has used some of its share of these federal dollars to offer child care enhancement and establishment grants up to $9,000 for expansion of child care businesses across the state. These grants have been very helpful, but in the absence of additional federal support, the state will have to take its own steps to support child care businesses. Helping child care business owners offset growing costs of operation can make it easier for them to stay in business or expand. One example, the state's business tax code includes educational services, which include private elementary or secondary schools, among the list of 16 types of service sector businesses that are exempt from paying the state's business tax. Child care, however, is not included under educational services, despite trends in the industry towards quality early childhood education at the preschool level. The Department of Revenue estimates that 400 or 500 child care businesses paid the business tax in each of the past 3 years, and their average yearly tax expense for those firms was $1,925. Every little bit helps, and including child care businesses under the exemption for educational services could allow them to direct more resources towards staff or other expenses. So on page 9, the last recommendation of the draft report is for the General Assembly to eliminate state and local business taxes for child care businesses and to offset losses in revenue to local governments by providing them with base amount of funding equal to what they had received in local business tax revenue from child care providers in the previous fiscal year. This concludes my presentation. I'm happy to take any questions, and thank you.
Thank you, Mr. Murillo. It's fascinating information. Senator Campbell, did you have?
Thank you, Mr. Chair. First of all, I want to acknowledge my colleague, Senator Charlene Oliver, who actually passed the bill for this study. She's here today, so thank you for doing this. So a couple questions. So DHS funds wages, but is this all federal funding? So that's one question. And then where do we stand? I mean, it is alarming to look at this annual mean wage of $27,480. That is alarming. So could you give me an idea of where we stand? I'm looking at these numbers. I know it's on this chart, but just we're pretty much in the lower bottom decile, it looks like, in terms of what we're paying our child care workers. Those two, yeah.
Thank you, Senator. To address your first question, the wages program, we have the information about that. It's at page 55, and yeah, that those funds are that it's state funds that they have. I'm sorry, I forget what you had a specific question about that about
Yes.
the wages program.
Right. Is it federal funding or is this all state funding?
I don't see where we have it. I don't recall if.
Senator Watson, maybe, do you know?
I do think, I didn't want to say that for sure, but yeah,
It's all federal.
yeah, okay.
It's all federal?
And that comes from the child care block grant, I believe, then. Okay. The CCD, yeah, the Child Care Development Fund that comes from the federal government. And
So, Mr. Chair, may I ask another question?
Certainly, Senator.
So, I just wonder about, you mentioned that there are some other states that are actually able to manipulate within that realm of being able to have a longevity bonus juxtaposed to just being for education. But, you know, I'd be interested in knowing what the parameters are in that in terms of whether or not that's an easy lift. In other words, I guess more specifically, does that require a legislative initiative or can that be a departmental decision?
so I think the decisions for how to allocate the Child Care Development Fund come from the state as far as within restrictions of certain percentages are required to go towards certain things for federal requirements. I'm looking at Virginia's program used a federal preschool development grant to start that program. But I believe, yeah, Georgia is investing state dollars for the program that it's put forward. So both could be looked at. And then with regards to the question about where Tennessee stands with wages for child care workers, you said we're in the lower portion. They're low for everyone, for all states across the board. And I think relative to wages for other industries in the state of Tennessee, it's a comparable proportion.
Senator.
Thank you, Mr. Chair. And so I guess I'd just like to say that, and when we're looking at affordability and affordable housing and all of these other issues, that affordable child care is at the very top of the list for reasons that families are finding things unaffordable. It's so crucial that we address child care affordability in this state, and I know that it's causing a lot of tough decisions for a lot of families, and I just want to flag that this meme wage is pretty appalling. Thanks.
Thanks, Senator. Any other members of the commission with comments or questions for Mr. Morio? Senator Oliver, your name was called. I'll follow the rules. Would you like to respond, and would you like to speak? You're recognized, madam.
Good morning, members of the committee and colleagues. Thank you for having me here, and I want to thank the TACIR team and the entire research team for doing this study. It was very revealing what we are facing in Tennessee, and not only revealing, but somewhat disheartening a little bit that the wages that our child care workers are facing in this state. I feel like this is something we should have at the top of our list in our legislature to do something about, especially when we think about this being a workforce issue. Employers are feeling the pinch. Parents are feeling the pinch. If I can't send my child to a daycare or a child care center, I can't go to work. So it's something that I think we should be doing something about, but it also is hopeful, because some of these things in the report that are mentioned, whether it's regulations or standards, seem to be easy fixes that we can also do. And I also want to just name that this is not a one-size-fits-all solution. It needs to be a comprehensive approach where we look at barriers, but also investments. And so if we can bring the child care workforce along, which I think is being left behind right now, then I think we can do something to really, really strengthen our economy. So I'm looking forward to working with my colleagues in the legislature this session to really dig deep on some solutions that will unhinge us from this crisis. So thank you, Mr. Chairman.
Thank you, Senator. Any comments, Senator Yarborough? For Mr. Moreo?
Yes, I had a couple more questions on this. So I think I may have told the story in this set, in when we had the panel here, but in my district, not 6 blocks from here, there's like a brand new building that's going to open in like 9 days. And like, you wouldn't believe all the things that are contractually required to go in that kind of building, from like recreational facilities to coffee, retail, and, all sorts of accessibility or environmental things. Like, the one thing that you can't actually contract to get in a building like that is childcare, because of the complexity. And that's, to me, relatively like a shocking development. Like, even when both sides of a transaction want to build it, I think that building that I'm talking about is going to have childcare, but they literally couldn't put it in the contract. It's kind of crazy, and I'm curious, how do we? I appreciate the notion of like there needs to be better alignment, more regular meetings, but like, given how complex this is and how big of a problem it seems to be in numerous places, I can't imagine that Tennessee's alone in that. And I'm curious if have there been other states that have found ways to really drive at change, to streamline and expedite that process, and sort of like how do you get government out of, this is just speak to my, my colleagues' hearts here. Like, how do you get government out of the way here where appropriate, so that people can build these things and expand supply just to meet the normal economic need? It seems like there have to be other ways to sort of drive that in a more strategic and intentional way. And maybe, and I hope I'm not attacking the report. I think the report is ungodly helpful. I'm just curious if there's other things that sort of turn the volume up a little bit, if you will.
Sure. Well, thank you for all of that feedback. And I think I probably want to follow up a little bit about the specific project, because I know, one of the challenges seems to be fire code, building and fire codes and fire safety codes. The international building codes are what, states and local jurisdictions adopt, are very careful with safety standards for anytime you get, small children who cannot get up and run out the door when an alarm goes off themselves. And so that seems to be, a driving factor in costs and things for these types of businesses. So seeing how you're talking about like a mixed use project with different areas and different occupancies for different things, those, speaking back to my previous life as an architect, that, are certainly really complicated to do. So I'm really interested in at least finding a little more about the details of the project. And to that end, I haven't found anything specifically where another state has either modified or done anything to its adopted building and fire codes that would alleviate some of those differences. There have been states that have done things with zoning to allow, the more childcare in homes, where, not allowing cities to exclude them, things like that. But for the example you're talking about, that I haven't seen anything yet, and I will take a deeper look into that specifically for the final.
And Mr. Chairman, if I can I appreciate that, and I think that like it's really helpful to have someone with an architectural background because I think that is, I think we know that there are, like any city or urban environment has to deal with this issue, and so it seems like people are facing this challenge everywhere, and so we would think there would be some path. I wanted to also think about the CCDF piece from the side of where it goes into vouchers for low income and how that then filters in to the system. Because I think are there pathways where by changing the way that we calculate those vouchers or exploring how that part works or finding new ways to leverage that program, are there ways to sort of increase the regularity or volume of revenue for certain places which would assist in certain ways in raising some of the wages and just sheer supply side forces?
So I know, one of the changes that was that may have some effect was making sure that the reimbursements are made for enrollment, versus just attendance.
Right.
So when you have, a child enrolled that's receiving the certificate, you're going to count on that certificate revenue versus, they don't come one day or another day, and that had been an issue. So that was something that was changing. I think looking at some of the numbers that, we did find that the overwhelming majority of the centers do accept certificates. I think it was like 80% of the ones we got survey responses from said they accept child care certificates. So it's considered pretty widely adopted, and we weren't getting complaints about it being difficult to administer from the provider's perspectives to that end. But just that it's, I think one of the reasons there's there's a low uptake is just the challenge of finding a slot period to put your kid in, just having the availability to find somewhere.
But I guess my question is more in the vein of how close to covering full cost, is it, and how much is it a true, one-to-one trade-off for a center?
So the DHS they've increased the reimbursement rates quite a bit. There's 15% differentials for adding on for infant and toddler reimbursements. The reimbursement rates go up higher for having the higher quality scores. So the reimbursement rates are in line with what the market rate studies come back with, generally speaking, broadly speaking, that the reimbursement rates are in line with what the market rate study is telling them, that their target was the 60th percentile, at least, for hitting that reimbursement rate. So,
Mr. Chairman, I'll just make one more comment, then I'll defer to other members. But I think just in preparation for the final report, if we could sort of think through if there are, I think something that's come up numerous times when we've been dealing with this legislatively has been whether we should take advantage of other options that the CCDF does allow for in this process, in terms of, rather than using market rate, using more of a cost orientation in the reimbursement, or if there are other ways for us to expand the shared services or other back office capacities in a way that just allow for leaner operations from the child care agency themselves to focus on the actual care of the child, as opposed to negotiating with landlords and governments and figuring out the infrastructure, the database infrastructure to do this. So, but this is great work, and I really appreciate it.
no, thank you. And there are several of those things that we can add to the final draft.
Thank you, Senator. And I don't see any other requests. Senator Watson.
and this may be a little bit outside of the scope, so, but I was just curious, under the federal programs that help pay for childcare, for those that are using the childcare, are there work requirements within the standards?
So yes, I do believe so. The parent meets there's an income requirement, and they have to be either working or actively seeking work.
Okay. All right, that's what thank you.
Mayor Waters.
Just one quick question, and that is, are any states allow, a lot of the larger businesses are furnishing child care, the ability for the workers to get, but the small businesses, don't think are financially able to do that. Is there any states that have the ability, that provides them the ability to have small businesses to have some sort of consortium where they can go together and provide child care as a group and in some sort of organization that they could put together? I mean, because the small businesses, a lot of them can't afford it, but might be able to if several of them went together. I don't know if any state allows that kind of consortium.
No, that's a good question, and I don't recall finding something specifically like that. It can be something we can go back and look at some of the research to see how other states may be providing that kind of assistance, whether it's through a grant to a nonprofit or to some other organization that then manages something like that for multiple small businesses. That would be something we can see if we can find.
Thank you, Mayor. And I was going to make a very similar comment that our newest industry, manufacturing, is providing on-site childcare, to speak to Senator Oliver's workforce development comments. And it seems to be very, very popular in a community like ours where, to your point, you said not enough slots for the children who actually are seeking daycare. We expect this new manufacturing company to have a very long waiting list of future employees simply because there's on-site childcare and other incredible incentives. One of my colleagues mentioned tax credits possibly as a way to incentivize, possibly at the city or county level as well. In fact, Mayor Anderson would like to speak.
Yeah, you could look at, run to the trustee's office. You've got tax credit, tax freezes, tax for credits for veterans, disabled, and you might could work through that model and see what that looks like. You're not abating the taxes; you just spread them out to the other remaining people in your county. But that doesn't get you the capacity, but it does offer some relief to those that need it.
Thank you, Mayor. And Mr. Murray, I would also like to thank you for the alignment comments and recommendations for the state fire marshal, local fire marshals, local building offices. It was the same conversations when this local industry, to Senator Yarborough's comments, it just wasn't in the book yet about how to accommodate and outfit and approve an on-site workforce development daycare. So I'm grateful for the alignment recommendations as well. Any other comments or questions from the commission? Thank you, sir, for your work. We look forward to the next and possibly final report.
Thank you, Mr. Mayor. Thank you, Commission.
That takes us to tab 6, which is Senate Bill 2487, House Bill 2616. And Dr. Matt Owen, welcome.
Thank you, Mr. Vice Chairman, and good morning, members. The draft report on school-based services and TennCare reimbursement for your review and comment today was prepared in response to a request from Senator Lundberg, Representative White, and Representative Sherrill. Having been made aware of an unresolved contract issue that was preventing one school district from receiving or seeking reimbursement for health services provided to students covered by TennCare, they sent a letter to Chairman Yeager this spring requesting that the commission study or review the problem and assist the parties in reaching a resolution. We have included that study request for you in Appendix A. The draft also includes the information that we discussed during my update presentation at the September Commission meeting, as well as a few minor additions that I will discuss shortly. But first, just a quick overview of the contract issue that led to the study. The contracts involved here are between school districts and managed care organizations, or MCOs. Under the TennCare program, MCOs are functionally similar to insurance companies in the private market, and contracting with an MCO is similar to becoming an in-network provider with a private insurer. And the key point for our study is that school districts must enter into contracts with the MCOs to be directly reimbursed for school-based services that they provide. In Tennessee, we have around 64 school districts that contract with at least one of the MCOs, but 2 of our districts, Knox County Schools and Metro Nashville Public Schools, have been advised by their legal staff not to sign the contracts because of concerns with some of the terms and conditions in them. Examples of those concerns include the length of the contracts, but also issues with some of the types of services that the schools might be obligated to provide, as well as potential obligations to provide service to members of the community who are not students, both of which were flagged for us by Knox County Schools attorney as potential liability issues for districts. So although these liability concerns haven't yet manifested in any problems, participants at an August stakeholder meeting that we facilitated generally agreed that the issues raised by Knox County Schools and MNPS are potential points of concern for districts. In terms of finding a solution, as I mentioned in September, we've discussed the contract issue with stakeholders multiple times over several months, and we have general agreement on a pathway forward involving the development of a contract addendum that could be used with school districts. Specifically, TennCare has agreed that a contract addendum could help resolve the issues that have been raised and has committed to exploring the creation of an addendum in conjunction with the MCOs. TennCare and the MCOs would then test the feasibility of this addendum with Knox County Schools, and depending on the results of that test, TennCare could consider whether to make the use of that addendum a requirement for the MCOs when contracting with districts. Because TennCare's proposed course of action aligns with what Commission staff would have recommended or would have proposed as a draft recommendation, the report for you today, in lieu of a formal recommendation, includes a statement on page 2 that the Commission supports the development of a contract addendum for MCOs to use with school districts. Moving on to the updates that I alluded to earlier. Since we last spoke about this report in September, TennCare has discussed contract modifications with both Knox County Schools and Blue Care, one of the state's MCOs. The next step was then for Blue Care to take that feedback from these meetings and propose a solution. And to that end, TennCare informed us this week that Blue Care has drafted a contract addendum, which is currently undergoing Blue Care's internal legal review. TennCare told us that Blue Care anticipates being able to share this addendum with Knox County Schools in early 2025. I think it's worth reiterating that throughout this process, TennCare has cautioned us a few times that reaching a final resolution could take time, in no small part because any solution will have to work for all 3 of the state's MCOs as well as the state's many school districts. And it will need to be reviewed and approved by the Department of Commerce and Insurance for compliance with state and federal law. One other update from our last meeting, if you turn your attention to pages 12 through 14 of the report, in particular Table 2, and you can also find some of this information in the back in Appendix B, we have included information about other states' Medicaid programs and how they handle school-based services and reimbursement for those services. we had a question in September about whether other states have dealt with similar contract issues and whether Tennessee could learn from some of the solutions that they have tried. The short answer is that Tennessee's decision to include school-based services within managed care and require districts to contract with the MCOs to be reimbursed is relatively unique. Most other states carve out school-based services from managed care in some, if not all, circumstances, allowing districts in those states to seek reimbursement directly from their state Medicaid agency. Although a few of the states we contacted reported similar complaints from their school districts when contracting with MCOs, they did not share any specific solutions that they might be considering to address those concerns. With that, I'm happy to take any questions you might have, and we plan on bringing a final report back for you at our next commission meeting.
Thank you, Dr. Owen. Is there a question or comment from the commission on this draft report? Senator Campbell?
Thank you, Mr. Chair. Thank you for that report. It's a little bit of a false comparison, I think, because obviously other states aren't dealing with the same, structure that we're dealing with. Can you remind us what specifically the issue is and what the addendum is going to accomplish?
Yes. So Knox County Schools attorney flagged several terms and conditions that he was concerned about that he thought created liability issues for the district. One of the examples that he brought up with us was the potential that schools might be required to provide a full suite of prenatal services to pregnant students. And he was concerned that schools were incapable of providing that level of service, and so therefore it would create a liability issue for districts. Similarly, he was concerned that some of the terms and conditions in those contracts, the way he read them, they might obligate the district to provide health services to any individual covered by TennCare, regardless of whether they were a student. So those were just examples of the things that he raised for us. And so when talking with different stakeholders about what a solution might look like in the context of Tennessee, a contract addendum was something that it looked like we could get forward movement on that might resolve those issues. That would just modify those terms and conditions within the context of what's allowed under federal requirements.
So more clearly, does this mean that we will not in those areas be required to provide prenatal services to girls who have gotten pregnant in school?
I would say that I might say it would be no, but I think it's what are the schools going to be required to do under these contracts? And it wasn't necessarily that no services could they provide. It was that some of the full suite of potential medical services that might have been required under that contract, the school was concerned they could not provide that.
Mr. Chair, may I? Would you be so kind as to get us specific information on what that addendum might look like and send it, at least to me? Maybe everybody else doesn't want to see it, but I would appreciate that.
Yeah, no, of course. As soon as we'll work with TennCare as soon as we can get access to a copy of that. We'll send that.
Thank you.
Along.
Thank you, Senator. Any other comments? Senator Watson.
Thank you. I just want to make sure I understand. This really would apply. See if I can phrase the question correctly. This would really would apply when the person providing the service is an employee of the school system, and the school system itself is trying to get healthcare payment versus a school system contracting with an entity, a business that already has a contract with one of the MCOs. Is that those are different animals, correct?
Correct. Our understanding from talking with TennCare is that a school district only needs to have one of these contracts if it wishes to be reimbursed directly for the services. So if they're hiring an outside staffing company or outside practice to come in, and that outside practice is the one who would be seeking reimbursement from TennCare through the MCOs, the school would not need a contract with the MCO in that case.
Okay, and maybe everybody on the commission is clear with that, but that's been a frequent discussion. For example, one of the more common is speech pathology. And you can have a business that is a speech pathology business that contracts with a local school agency and provides speech pathology services that are medical in nature, and then they bill the MCO for the services provided, and then that business is paid for the services rather than the school system getting the money for those services. Is that correct?
Yes.
Okay, thank you.
Thank you, Senator. Any other comments or questions for Dr. Owen? Seeing none, thank you for the draft, and we look forward to the future report.
Thank you.
All right, that takes us to tab number 7, which is Public Chapter 937, Youth Vaping, is going to be presented by Senior Research Associate Jennifer Arzate. Thank you.
Good morning, Commission members. My name is Jennifer Arzate, and I'll be presenting on the Commission's draft report on youth vaping today for your review and comment. You can find a copy of the memo under tab 7, and staff will present a final report at the January meeting. This draft report was prepared in response to Public Chapter 937, Acts of 2024, which directed the Commission to study the effects of youth vaping and the use of all vapor products by persons under 21. The study was to include initiation of vapor product usage, health outcomes, enforcement of underage sales, best practices to address usage on school grounds, taxation and access to cessation and products and services. The Act also directed the Commission to identify the prevalence of vaping among the under 21 population, including demographics and usage trends. Youth vaping rates in Tennessee are more than double the national average, 22% compared to 10% for high school students. And despite stricter regulations, including raising the minimum age to 21, youth vaping rates remain high. There is a widespread belief that vaping is a safer alternative to smoking, though the health risks associated with vaping are still significant. Health risks include long-term health challenges like asthma, cardiovascular disease, and chronic obstructive pulmonary disease, or COPD, with young people whose brains are still developing being particularly vulnerable to nicotine addiction. While vaping has been marketed as a less harmful alternative for adult smokers, evidence suggests the health benefits may be limited. Many young users never smoked before vaping, and some adult vapers become dual users, combining cigarettes and vaping. While vaping may be less harmful than tobacco products, it is not harmless, and there are still risks. There is a broad consensus that youth vaping is an issue and must be addressed, but there are differing opinions on how best to achieve this. Research shows that taxing vapor products can reduce consumption. Tennessee, however, has not imposed specific taxes on vapor products beyond general sales tax, and unlike the additional taxes levied on cigarettes and other tobacco products. Health advocates argue that taxing vapor products at similar rates could discourage youth usage while generating revenue for prevention and cessation programs like the Tennessee Department of Health's Tobacco Use Prevention and Control Program. Flavor bans also target youth appeal with flavors like cotton candy and blue Jolly Rancher. Health advocates argue these products are designed to attract young users. Although 9 states have enacted flavor bans, Tennessee is not one of them. Adult users, however, also enjoy flavored products, with fruit and candy flavor being in their top 3 preferences. A vapor product directory could list approved products and potentially enforce flavor bans as well. However, its effectiveness in reducing youth vaping remains unproven. Vape shop owners argue it would duplicate federal regulations and burden businesses without addressing underage usage directly. While these measures aim to protect young people, it's important to balance them with the rights of adult consumers and businesses. The goal is to reduce youth vaping without overly burdening responsible businesses or restricting the choices of adults. Therefore, the draft has 4 recommendations. Representatives of convenience store owners say that when universal carding was enacted for carry-out beer purchases in Tennessee in 2006, it reduced underage access to beer by 1/4. They say it helps deter underage purchases by taking the judgment call of who to card away from the clerk. Because of its potential to reduce the sale of vapor products to persons under the age of 21, the draft report recommends that the General Assembly require vapor product retailers to check the identification of all purchasers, regardless of age, in other words, universal carding. States with licensing with a licensing requirement for vapor product retailers tend to have lower rates of youth vaping, and licensing could help the state's existing inspectors better enforce age restrictions by identifying more vapor product retailers. Revenue generated from licensing fees could be used to prevent underage sales of vapor products, and both health advocates and pro-vape stakeholders are supportive. For these reasons, the draft report recommends that the General Assembly establish licensing for vapor product retailers. Prevention and cessation programs for youth vaping are effective according to research, but many counties in Tennessee lack such programming, especially cessation programming, in part because of a lack of funding. To combat youth vaping, the draft report recommends that the General Assembly increase consistent and recurring funding for the Tennessee Department of Health's Tobacco Use Prevention and Control Program to expand existing efforts for prevention and cessation in Tennessee. School districts collect discipline data, but reports to the Tennessee Department of Education don't specify the offense. More detailed discipline data would provide policymakers with better information on which substances are being abused most often, where to focus enforcement, prevention and cessation efforts, and to aid future research. The draft report recommends that the Tennessee Department of Education require school districts to report more specific substance abuse information, including vaping offenses, in their annual discipline reports. This concludes my presentation. I'd be happy to take any questions.
Thank you so much for that draft report. It is an incredibly important topic, which is ravaging the city of Cleveland and our Cleveland City schools right now, and so I'm very thankful to see these 4 recommendations. Are there any comments or questions from the commission? Yes, Ms. Gaither, County Clerk.
So I have a recommendation. If the counties could have a vape board similar to the beer boards, if the legislature does have, where there's regulatory licensings and things like that, when they violate, they would have a board that they would go before. So that may be something you want to look at too.
Thank you. And I can say that recent enactions or new strengthening of current law enforcement, our district attorney, former district attorney who was here earlier at the earlier panel, and the now current district attorney, there have been to me, a wonderful increase in the ability to enforce jurisdictional ramifications for people that are selling to underage, people that aren't properly licensed. It literally, vaping is the Wild West. It's not under any regulatory of any kind. And so I'm very thankful for this. Senator Campbell.
Thank you, Mr. Chair. That's a great idea. And I agree with you. It is the Wild West. Ostensibly, it was supposed to be, I guess, a smoking cessation, or pitched as a smoking cessation tool. But really, what it's done is open up the opportunity for kids to adopt vaping because of obviously the fact that they can get away without, the smell of smoke and all kinds of stuff. And as you stated in this report, we have double the amount of kids vaping in this state than comparatively in other states, which is alarming from a health perspective. It sounds like a little bit of a public health emergency. I just wanted to point out that the health advocates supporting a flavor directory is not, one of my health advocates reached out to me and asked that be eliminated. They don't support a flavor directory, so I'd like to get that on the record. The flavor thing is obviously targeted towards kids. I understand that some adults like that, but it is a real problem. So I'll just point that out. Thanks so much.
Thank you. And Senator, I would agree with your comments. Mayor Frank?
Yes, I guess in the when we had our panel, I missed understanding one of the lines you have is that most of the vaping products have nicotine. So there are some that don't have nicotine. Is that correct?
That is correct.
Okay. And I guess I bring that up because I think about our code, our TCA, and our tobacco tax. And I think in terms of parity, we need to really flesh that out. I mean, your report is great, and I'm not asking you to change anything. I'm just making a comment that is it the tobacco leaf or is it the nicotine is the reason we're taxing them? And so I know it's not part of the recommendation, but it is part of your report, and I think that's very valuable for the General Assembly to look at in terms of parity.
Thank you, Mayor Frank. Mayor Brown?
I appreciate what you just said because I've had the same thoughts, but I think that as data comes in, they're going to continue to have demonstrated support that there are health impacts from inhaling anything into your lungs, whether it's nicotine or the chemicals that are in the non-nicotine different inhalants that are out there. I really appreciate, and my thing is just a comment, I really appreciate the recommendations because I think most of us in local governments are really seeing the impacts, not just on, that's not just about the youth vaping, which is very, 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 very important, but it has become the probably #1 nuisance business in a lot of our communities. And this gives us a way to, I mean, they're every corner in our community, and that, so I think it will help in those instances as well. And I don't want to come across as picking on a business, but I do think that you know, these businesses are not creating their own standards to the desire that we would like to see in a community, and I think this would help that.
Thank you, Mayor Brown. I echo those comments. And what we're seeing in Cleveland, Tennessee, is making the leap from just a vape, if I can use that term, to now the Delta 8, Delta 9, CBD, and the leap from cotton candy flavored to now something far more serious. And I'm thankful that our local district attorney is trying to find ways to crack down on that. And I know it raises an entirely different discussion on hemp and CBD oil and is it safe or is it not. But when the director of Bradley County Schools is reporting to us that children are falling out of their chairs in the classroom because of something that they've inhaled or something in the hallway or bathroom, at some point the adults in the room have to make a decision of, is this safe for our children? So I'm very thankful. Mr. Peach?
Basically, just a comment to kind of follow up with Ms. Gaither had talked about. Just as a reminder, if you remember the bath salt days that we were dealing with those, what we did in Smyrna, instead of having an additional board, is most of these places, not all, that are selling these also sell alcohol. And so generally you cannot do any criminal behavior on there, so you can tie that to their beer permit and discipline them in those ways if they're not following all of the state's rules.
Yeah, it's a great comment. Any other comments or questions from the members of the commission? Very informative draft report, and we look forward to seeing more work. Thank you very much. All right, Mr. Director, we are rapidly ending the end of our published agenda. I will allow you, Dr. Lippard, to begin the discussion on next meeting dates.
Well, as the members probably already know, we have reached out, surveyed the members on potential dates for our next meeting, partly because we needed to get ahead of the curve and schedule a room with the legislative session starting up again next month. So what we have arranged is for another one-day meeting on, unfortunately, it'll be on a Friday, January 31st, but that was the only day we could get the meeting space. So unless there's any significant objection, the next meeting is scheduled for Friday, January 31st.
All right, and that will begin at 8:30. That will also begin at 8:30.
We could, I mean, if the members wish, we could scoot it back as late as 9, but right now it's scheduled for 8:30.
Any wishes from the commission on the start time? Some of our members have farther to drive.
I'm sorry, I'm still in shock from the date. Go ahead, tell me that again.
January 31st. All right. All right, then we will keep it at 8:30, January 31st. Members of the commission and staff, thank you for the hard work. We wish you all a very Merry Christmas and Happy Holidays.